As a neurologist, I must warn you about something many people do not realize. Stroke rarely comes without warning. In fact, your body may begin sending signals days before the attack strikes. Yet, too often these signs are dismissed as minor issues or ignored completely. This mistake can cost precious time. And in the case of stroke, time is the difference between recovery and lifelong disability. A stroke happens when blood supply to the brain is suddenly blocked or when a vessel bursts, cutting off oxygen. Within minutes, brain cells begin to die. But in the week leading up to a major event, the body often cries out for help. Severe unexplained headaches, sudden vision problems, dizziness, weakness in the limbs, difficulty speaking, brief memory lapses, or overwhelming fatigue may all appear as red flags. Each of these can last only minutes or hours and then seem to resolve. But they are not harmless. They are the brain's urgent warning that blood flow is unstable and a crisis may be imminent. The tragedy is that many people choose to rest, take a pill, or wait for it to pass instead of seeking medical attention. By the time a full stroke arrives, the golden window for prevention is gone. The hopeful truth is that recognizing these signs early and acting immediately can save your brain and even your life. In this video, I will reveal the 7 warning signs that often appear up to a week before a stroke, explain why they happen, and show you what actions to take. Do not ignore them, and do not assume they will disappear on their own. Before we begin, I want to ask you something. Have you ever experienced sudden dizziness, blurred vision, or unexplained weakness and wondered if it might be serious? Share your story in the comments below, because your experience may help someone else recognize the danger before it is too late. 1. Severe headache. Headaches are among the most common complaints in medicine, and most of the time they are harmless, linked to stress, fatigue, or dehydration. But when it comes to stroke, a particular type of headache can serve as an urgent warning. This is not the usual dull ache that fades with rest or fluids. It is often sudden, intense, and unlike any pain you have felt before. Patients describe it as explosive, sharp, or spreading quickly across the head without a clear cause. When such a headache occurs, especially in someone with high blood pressure or vascular disease, it can be the brain's way of signaling that a blood vessel is under extreme stress or that circulation is being compromised. The medical term for the most dangerous type is a thunderclap headache, and it may signal bleeding inside the brain. Even headaches that build gradually but remain unusually severe can indicate that oxygen delivery to parts of the brain is failing. Ignoring these pains or treating them with simple painkillers is a mistake. A painkiller may dull the sensation temporarily, but it does not address the underlying threat. The biology behind this warning sign is straightforward. When blood flow is blocked by a clot, or when pressure builds inside fragile vessels, nerve pathways inside the brain react with pain. The body is sounding an alarm, one that should not be silenced but investigated. The critical mistake many make is assuming a headache will pass. They may lie down, wait it out, or blame stress. Meanwhile, precious minutes slip away. And if the vessel bursts or the clot enlarges, a major stroke can begin. Early medical intervention at this stage can be life-saving. Imaging tests such as CT scans or MRIs can reveal whether there is bleeding or blockage. Doctors can then act quickly, prescribing clot, dissolving drugs, adjusting blood pressure, or preparing surgery if needed. But none of this is possible if the patient never reaches the hospital. Consider a scenario where a person experiences a headache so fierce they cannot describe it, but it fades after a few hours. They feel relieved. But in reality, that event may have been a transient ischemic attack or a small vessel leak. Days later, a massive stroke can strike without mercy. Recognizing that severe, unusual headache is not just discomfort, but a potential red flag can prevent this outcome. The advice is simple but vital. If you or a loved one experiences sudden, unexplained, and intense head pain, do not wait. Seek emergency care immediately, even if the headache turns out not to be related to stroke. Ruling out the danger is worth it. Stroke destroys millions of brain cells each minute it goes untreated. And headaches are sometimes the earliest and only warning. Think of this pain not as an inconvenience, but as the brain's cry for help. Listening to it and acting fast can mean the difference between life, death, or lifelong disability. Never dismiss a headache that feels different, sharper, or more overwhelming than usual. Treat it as an emergency and get medical help without delay. 2. Vision problems. Your eyes are often described as the windows to the brain, and for good reason. The visual system is directly connected to delicate networks of blood vessels that feed the brain. When blood flow to these regions is disrupted, vision changes are often one of the earliest signs. Many people dismiss these changes as eye strain, fatigue, or aging. But in reality, sudden vision problems can be a serious warning of an impending stroke. The problems may present in several ways. Some people notice that their sight becomes blurry without explanation. Others find that their field of vision narrows, as if a curtain has been pulled across part of the eye. Blind spots or dark patches may appear, making it difficult to focus. Double vision can also develop where objects overlap or appear unstable. In more alarming cases, vision in one eye may suddenly dim or disappear entirely. These disturbances can last only a few minutes, or they may persist. But either way, they should never be ignored. The underlying reason is straightforward. When blood flow to the brain's occipital lobe or to the optic pathways is reduced, oxygen supply to the cells responsible for processing images is disrupted. This leads to temporary or permanent dysfunction in sight. In ischemic stroke, where a clot blocks circulation, this may be the first sign that part of the brain is starved. In hemorrhagic stroke, sudden bleeding can compress visual centers, leading to abrupt changes in vision. What makes this particularly dangerous is that many people attribute vision changes to less urgent causes. They may think they need new glasses or blame glare from a screen. Some may even wait days or weeks before seeing a doctor. During that delay, the risk of a full stroke grows higher. Vision problems linked to stroke are not subtle changes that develop slowly over years, like cataracts or age-related presbyopia. They are sudden, noticeable, and often frightening. That sudden quality is what sets them apart and should raise immediate concern. Medical evaluation is critical. Eye exams alone may not reveal the true cause, because the problem does not always lie in the eye itself, but in the brain behind it. Imaging of the head and circulation studies are needed to determine whether the warning is pointing toward a dangerous blockage or vessel rupture. The advice here is urgent and clear. If you or someone you know experiences sudden blurred vision, loss of sight, double vision, or unexplained blind spots, treat it as an emergency. do not drive yourself. Call for help and seek immediate care, even if symptoms resolve within minutes. This could represent a transient ischemic attack, a powerful predictor of a larger stroke soon to come. Ignoring vision changes can lead to irreversible brain damage, blindness, or worse, acting quickly. However, allows doctors to intervene, restore circulation, and prevent tragedy. Your eyes are telling you more than you realize. Listen carefully, because when vision fades suddenly, it may be your brain's urgent cry for help. 3. Dizziness and loss of balance. Dizziness is a symptom many people casually dismiss. They may assume it comes from standing up too quickly, being tired, or even skipping a meal. But when dizziness appears suddenly, feels severe, or is paired with difficulty walking or staying upright, it can be a serious neurological warning. Loss of balance, staggering steps, or the sensation that the room is spinning are not just inconveniences. They can signal that a stroke may be approaching. The brain relies on a precise flow of blood to areas that control balance and coordination, such as the cerebellum and brainstem. When circulation is disrupted in these regions, even briefly, a person may experience vertigo, unsteadiness, or the inability to coordinate simple movements. This is why dizziness and loss of balance often precede a stroke. These symptoms should never be ignored, particularly when they come on abruptly or without obvious explanation. For example, someone might rise from a chair and suddenly feel unable to walk in a straight line. They may need to hold on to furniture for support, or they may stumble without warning. Others describe a sensation that the ground is shifting beneath them, accompanied by nausea or the urge to vomit. These are not signs of simple fatigue. They are indications that blood flow to critical centers in the brain has been compromised. The danger increases because dizziness often overlaps with other warning signs. If blurred vision, slurred speech, or weakness in the limbs accompanies balance problems, the likelihood of an impending stroke is extremely high. Too often, however, people explain it away as an inner ear problem or a temporary spell of lightheadedness. By the time they realize something more serious is happening, the stroke may already be underway. Medical science explains this link clearly. A clot restricting blood supply to the posterior circulation of the brain can directly impair balance centers. In hemorrhagic strokes, bleeding in the cerebellum can create pressure that distorts coordination. Both scenarios create instability, confusion, and a risk of falling. Falls themselves are dangerous for older adults, but the deeper risk lies in ignoring the cause. Immediate evaluation is essential. Doctors can perform neurological exams and order imaging tests to determine if blood flow to the brain is being threatened. Treatments that restore circulation or control bleeding are time-sensitive, meaning action must be taken as soon as symptoms appear. The advice here cannot be overstated. If dizziness strikes suddenly and is more intense than usual, if you lose your ability to stand and walk with stability, treat it as a possible stroke warning. Do not wait to see if it passes. Call emergency services and remain seated or lying down until help arrives to avoid injury from falling. Remember that stroke does not always begin with paralysis or speech problems. Sometimes it begins with dizziness so powerful it takes away your balance. Listening to this signal and acting quickly can save your life and prevent permanent disability. 4. Numbness and weakness in the limbs. One of the most classic and alarming warning signs of an impending stroke is sudden numbness or weakness in the limbs. often affecting just one side of the body. This symptom reflects a direct disruption of blood supply to the parts of the brain responsible for motor control and sensation. When these regions are deprived of oxygen, even briefly, the signals that allow muscles to move and skin to feel begin to fail. Many patients report that one arm or leg suddenly feels heavy, weak, or unresponsive. They may attempt to lift both arms, but find that one drifts downward. Or they may try to walk and notice that one leg drags or gives way. Sometimes the weakness is accompanied by a tingling sensation, described as pins and needles, or a complete loss of feeling in the limb. The face can also be involved, with one side appearing drooped, making it difficult to smile evenly. These changes may last only a few minutes in the case of a transient ischemic attack. But they are never harmless. They are the brain's urgent cry for help. The underlying cause is almost always reduced blood flow. A clot may have lodged in a vessel supplying one hemisphere of the brain, or a narrowing artery may no longer deliver enough oxygen, because each side of the brain controls the opposite side of the body. Damage to the left brain may cause weakness on the right side and vice versa. The danger is that these early episodes often resolve spontaneously, leading people to believe nothing serious is happening. This false sense of security is dangerous, because studies show that many individuals who experience brief weakness or numbness go on to suffer a full stroke within days or weeks. Immediate medical evaluation is crucial. In an emergency setting, doctors will test muscle strength, reflexes, and coordination to confirm deficits. Brain imaging can reveal whether a blockage is forming or whether a vessel has ruptured. Treatments, including clot-dissolving medications, must be delivered quickly to be effective. The sooner treatment begins, the more brain tissue can be saved. The practical advice is clear. If you suddenly feel weakness, heaviness, or numbness in an arm, a leg, or on one side of the face, treat it as an emergency. Do not assume it is fatigue, a pinched nerve, or poor circulation. Call for help immediately and do not attempt to drive yourself. Even if sensation and strength return within minutes, the warning has already been given. Your brain has shown you that its blood supply is unstable, and the next event may be far more destructive. Remember that stroke does not always announce itself with dramatic collapse. Sometimes it whispers first through a weak grip, an unsteady step, or a lopsided smile. Listening to these whispers and acting quickly may spare you from losing speech, mobility, or independence for the rest of your life. 5. Speech difficulties. Few symptoms are as alarming and as closely tied to stroke as sudden difficulty with speech. The ability to form words, express thoughts, and understand language depends on finely tuned areas of the brain, particularly in the left hemisphere. When blood supply to these regions is interrupted, the result can be immediate and dramatic. A person may suddenly slur their words, struggle to find the right expression, or fail to understand what others are saying. These changes can appear without warning and are among the clearest signals that the brain is in danger. Speech difficulties take several forms. Some individuals develop slurred or garbled speech, making their words hard to understand. Others may know exactly what they want to say but cannot recall the words, a condition known as expressive aphasia. Still, others may speak fluently but the words come out jumbled or nonsensical. In receptive aphasia, a person hears language but cannot comprehend it, as if the words were in a foreign tongue. These disruptions are not caused by tiredness or distraction. They are caused by disrupted blood flow to language centers of the brain. What makes this symptom particularly important is its reliability as a stroke warning. In medicine, when someone suddenly cannot repeat a simple sentence or articulate clearly, stroke is one of the first concerns. This is why emergency protocols often include a quick speech test. Asking a person to repeat a common phrase can immediately reveal whether a critical part of the brain is losing oxygen. The danger lies in dismissing these episodes. Families sometimes assume the person is anxious, exhausted, or yoking. The individual may recover within minutes, especially if it is a transient ischemic attack, and may shrug it off. Yet this recovery is deceptive, because it means the brain has already been deprived of blood once and may be on the brink of a major stroke. The biology behind speech impairment in stroke is straightforward. A clot or ruptured vessel in the left middle cerebral artery territory disrupts neural networks that coordinate speech and comprehension. Without immediate treatment, damage spreads and the ability to communicate may be lost permanently. Survivors of stroke often describe the heartbreak of knowing exactly what they want to say, but being unable to form the words. Others struggle for years to relearn language skills, a process that is difficult and often incomplete. The practical lesson is simple. If you or someone near you suddenly cannot speak clearly, begins slurring, or appears unable to understand language, treat it as a medical emergency. Do not wait to see if it improves. Call for help immediately. Every minute matters, because the longer language centers go without blood, the more likely the damage becomes permanent. Stroke can steal independence in many ways, but taking away the ability to communicate is one of the most devastating. By acting fast at the first sign of speech difficulty, you can prevent this loss and protect both brain and quality of life. 6. Temporary memory loss. Memory is one of the most treasured human abilities, allowing us to recall names, places, and experiences that give life meaning. When memory suddenly falters, especially in an otherwise alert person, it can be a sign that the brain is not receiving enough blood. Temporary memory loss in the days before a stroke is often overlooked, mistaken for stress, distraction, or normal aging. But in reality, it may be the brain's cry for help. This warning sign can appear in subtle ways. A person might suddenly forget the name of a close relative, lose track of where they place familiar objects, or become disoriented about time and location. They may have trouble recalling recent conversations or forget important appointments despite usually being reliable. In some cases, the confusion lasts only a few minutes and then resolves. But this does not mean it should be ignored. Each episode indicates that the parts of the brain responsible for storing and retrieving memory, particularly in the temporal lobe and hippocampus, are experiencing reduced oxygen supply. The biological explanation is straightforward. When a clot temporarily narrows or blocks a vessel feeding memory centers, nerve cells lose energy and cannot function normally. Once blood flow resumes, memory may return, creating the illusion that nothing serious happened. But the damage from repeated episodes accumulates, and eventually one blockage may become permanent, causing a full stroke with lasting impairment. Many patients and families fail to recognize the urgency of these lapses. They may laugh them off as senior moments or assume the person is simply tired. Yet medical studies confirm that transient memory loss in older adults, when sudden and unusual, is strongly associated with increased risk of stroke. The tragedy is that this is also one of the most preventable outcomes. If only people seek medical evaluation at the first sign, Doctors can perform neurological exams and imaging studies to determine whether blood flow is unstable. Early treatment can include controlling blood pressure, managing diabetes, adjusting medications, or prescribing blood thinners to prevent clots. Without this intervention, however, the risk of a major stroke rises dramatically. The impact of memory loss from stroke is profound. Survivors may struggle to recognize loved ones, remember personal history, or maintain independence. Families often describe the heartbreak of seeing a parent or spouse lose not only their physical abilities but also their connection to shared memories. Prevention begins with vigilance. If you or someone close to you suddenly forgets familiar names, loses track of time, or experiences confusion without cause, do not dismiss it as age or fatigue. Treat it as a possible warning of stroke and seek immediate care. Even if the episode passes, it should be taken seriously. The brain rarely gives second chances. Recognizing temporary memory loss as an urgent sign can allow doctors to intervene before permanent damage occurs. Remember, every memory is a piece of who you are. Protecting them means protecting your brain. And that begins with listening to the warning signs and acting without delay. 7. Fatigue and lack of energy. Fatigue is one of the most common complaints in modern life, often blamed on poor sleep, busy schedules, or aging. Yet, when exhaustion becomes overwhelming, persistent, and cannot be explained by normal activities, it may be an early signal of stroke. In the days before a major attack, many patients report feeling drained of strength, as though their body is weighed down and unable to respond with its usual energy. This fatigue is not simply tiredness after a long day. It is a deep and unusual lack of vitality that lingers even after rest. The reason lies in how the brain and body interact. When circulation to the brain is unstable, oxygen delivery to tissues throughout the body becomes less efficient. The brain itself, deprived of steady blood flow, struggles to coordinate the countless functions that maintain energy, focus, and alertness. This disruption produces symptoms such as constant drowsiness, difficulty concentrating, pale skin, and a general sense of weakness. In some cases, the fatigue is so intense that daily tasks such as climbing stairs, cooking a meal, or even holding a conversation feel exhausting. Families may notice that the person appears slower, less engaged, or lacking motivation, but they may attribute it to aging or stress. Unfortunately, this assumption can delay urgent medical evaluation. Studies show that fatigue linked to impending stroke often comes with other subtle signs such as dizziness, vision problems, or mild weakness in the limbs. When these are present together, the likelihood of a cerebrovascular event increases significantly. Ignoring the fatigue and trying to push through it is dangerous, because it signals that the brain is under stress and close to failing. The tragedy is that many people wait, believing that a good night's sleep will restore them. By the time they realize something more serious is happening, the stroke may already be in progress. Recognizing unusual fatigue as a potential neurological warning allows for early intervention. Doctors can evaluate circulation, check for high blood pressure, abnormal heart rhythms, or blood sugar issues that contribute to risk. With proper treatment, such as medications to stabilize blood pressure or prevent clots, the stroke can often be prevented. For survivors, fatigue is one of the most disabling long-term consequences of stroke, making even simple tasks a burden. Preventing this outcome begins with listening to the body before disaster strikes. The practical advice is clear. If you or a loved one suddenly feel an unexplained and persistent lack of energy, do not ignore it. If rest does not help, if daily activities feel unusually hard, or if fatigue appears alongside dizziness, memory lapses, or speech problems, treat it as a red flag. Seek medical evaluation immediately. Stroke is not only about sudden paralysis or loss of speech. It can also whisper through days of exhaustion before the final blow. Do not wait for the crisis. Respect the warning. Act quickly. And give your brain the chance to stay strong and resilient. Doctor's final words. As a neurologist, my final message is that stroke rarely arrives without warning. In the days or even the week before an attack, the brain often sends clear signals that something is wrong. Severe headaches, sudden vision changes, dizziness, weakness in the limbs, speech difficulties, temporary memory loss, and overwhelming fatigue are not random events. They are the body's desperate attempt to alert you that blood flow to the brain is unstable and that time is running out. The tragedy is that too many people ignore these warnings, waiting for them to pass or blaming them on stress, aging, or lack of sleep. By the time they realize the truth, the golden window for intervention has closed. Stroke kills brain cells by the millions every minute. And once gone, they cannot be replaced. Yet the hopeful truth is that early recognition and immediate medical action can save lives and preserve independence. If you notice these signs in yourself or a loved one, do not delay. Call emergency services, get to the hospital, and let professionals act quickly. Even if the symptoms resolve, they should be treated as a serious warning, because the next episode may be far more devastating. Prevention is always better than treatment. Controlling blood pressure, managing diabetes, eating a healthy diet, staying active, and avoiding smoking or excessive alcohol can reduce risk. But vigilance remains key. The body whispers before it screams, and those whispers come in the form of these 7 warning signs. My advice is simple: do not ignore them. Share this knowledge with your family, your friends, and your community. Because awareness can save lives. And before you leave, I want to hear from you. Have you or someone close to you ever experienced sudden headaches, dizziness, or weakness that you now realize might have been a warning? Share your story in the comments. Your words may help another person recognize danger in time and prevent tragedy. Remember, stroke does not have to steal your future. By listening to your body and acting quickly, you can protect your brain, your independence, and your life.